Yes, I can hear you.
Everyone. Okay, welcome. It's so great to see you. It's been such a long time since we've been able to have a meeting. And you have an agenda, and I hope you had a chance to look at that in the minutes of the last meeting. I thought since it's been such a long time, maybe we could all just kind of go around and introduce ourselves and say where we're from. Because not everybody is with the Human Rights Commission, but I'm very glad that the work plan includes everyone on the membership of this task force. So I'm Tommy, and I'm on the Human Rights Commission, and I chair this committee. And we've got Dominique.
I'm the liaison for the Human Rights Commission.
She's wonderful.
Okay. Is it Andrea or Andrea?
Andrea.
Okay. Okay. Your mic is open if you.
Hi, I'm Andrea Brick. I'm with the Virginia Beach Police Department and our Crisis Intervention Team program, CIT officer since we started our program 10 going on 11 years now. I've known several of you active on NAMI, used to be on the board of directors for NAMI several years ago. So yes, happy to be here.
Great.
Right.
Great.
Thank you. Thank you. Next, Carla, your mic is open.
I'm on the Human Rights Commission, also serve on the Community Services Board, and I'm on the Behavioral Health Committee for that as well.
That's great too. Yeah.
Thank you. Okay, looks like Ginger was able to join us on the video. Ginger, can you hear us?
Yes, I can. I'm working on getting.
I can't see you.
Oh, well, we can hear you, so that's good. And I know you're probably going to get your video working soon. So welcome. Thank you, Ginger. Okay, Jen, your mic is open.
Oh, hi, I'm Jen Williams. I'm with NAMI, Coastal Virginia. Glad to be here. Glad to see all your faces.
All right, great. Thank you. Thank you. Shelby, your mic is open.
Okay. Oh, hi. I'm Shelby Giles, and I'm with the Department of Behavioral Health Developmental Services. I work for the Behavioral Health Division, and I'm the Clinical Services Administrator there. I also sit with the Mental Health Committee. So I am just so glad to see you all again, see your lovely faces again. It's been too long. Wow.
Okay, thank you, Shelby. Sylvia, your mic is open.
Hi, Sylvia Strickland with the Human Rights Commission.
Thank
Glad
you.
to be here.
Oh, Sylvia. Yeah, there you are.
Teresa, your mic is open.
Jen, comment. It's so good to see your faces again, especially yours, Andrea. I've just missed you and been so concerned. So I hope you've been feeling our prayers. I'm Teresa Stanley. I'm also part of the Human Rights Commission, but I wear quite a few other community hats to include a lot with the faith community.
Thank you, Teresa. Okay, and that's all for our introductions. Back to you, Tommy.
Oh, thank you. So the minutes of the last meeting, which was February 26th, were sent out to you. And if you had a chance to look them over, did you have any comments or questions about those minutes from February 26th, which was our last meeting?
You can raise your virtual hand if you have any comments or any discussion. Okay. All right, I'm not seeing any virtual hands.
So do we have a
wait, one second. I have one right here. I have a virtual hand by Vice Chair Jenkott. Ginger, your mic is open.
Hi there. Hi, everybody. I move that we accept the minutes as presented today.
Okay. Thank you. Does anyone else want to second? Anyone want to second the motion to approve the minutes? I have a virtual hand up by Teresa Stanley. Teresa, your mic is open.
Second the motion.
Okay, thank you. All right, any discussion on approval for the minutes from the February 26th meeting? No discussion. Okay, in that case, I'm going to do a quick roll call vote for approval of the minutes from the February 26th meeting. Andrea?
Yes.
Okay, thank you. Carla?
Yes.
Thank you. Ginger?
Yes.
Thank you. Jen?
Yes.
Thank you. Shelby? Oh,
Yes.
wait.
Yes.
Thank you. Sylvia?
Aye.
Thank you. Teresa?
Yes.
Thank you. And Tommy?
Yes, yes.
Okay. So with that, the minutes were approved.
Okay, the next thing on our agenda is updates, mental health related activities since the February meeting. Does anyone have anything they want to report? I was going to report some on STEP about what kind of activities you've been engaged in that relate to mental health, especially to the things that we're working on.
I have a virtual hand up by Jen. Jen, your mic is open.
I just wanted to let you all know that we've increased the number of NAMI has increased all of the number of support groups. We have them 5 times a week now. This is for people who live with a mental health condition. We still have a family support group twice a month. At our peer-to-peer classes as well, children's challenge behavior, and almost every month having a community-wide presentation on a mental health topic. So we're trying hard to help the mental health challenges with people being in support groups because of monetary reasons, not having a computer or not having a smartphone or not having an internet connection. But we have, on a positive note, we have gained people attend the support groups and the classes for various reasons. So we're happy about that.
Oh, that's good. That's very good. Thank you.
Thank you. All right. And having a virtual hand up by Teresa. Teresa, your mic is open.
I just want to piggyback on Jen's report, which, by the way, kudos to NAMI for staying so accessible, and the children during the pandemic offering was, dealing with problems during that was, amazing. Heard wonderful things, and our legislative collaborative table visits have expanded from Southampton Roads to include Hampton Roads. So we now have 30 visits that are being scheduled. We're through quite a few of them because they have to be done before the holidays. And the receptivity for Step Virginia, which is our agenda, has been excellent. Excellent. So it's, just to show that advocacy is alive and well, and Tommy catch us up on exactly what it is the advocacy is, I'm sure. So I won't steal that thunder, but also wanted to let you know that Kay Ashby and help me, Jen, with Susanna's last name. Susanna's last name. Sirosky. The Season for Nonviolence Collective, which is also with the Human Rights Commission, are going to try to listen to a proposal that is going to be very creative in trying to work with getting more of the Say It Out Loud, Ending the Silence into their schools. And so we'll be hearing a report on that and hopefully embracing that young people engaged in pushing it forward in January, which will go on through May all the way to Mental Health Awareness Month. So thank you, Jen.
Very good. Very good.
Thank you, Teresa. Jen, did you have more to say? I see your virtual hand is still up. Oh.
No, I think it's just up. I just need to get it on my deck.
Yeah, if you press the button again, your hand will go down.
I will do that.
All right, thank you. Okay, any more questions or any discussion, anything to add? Okay, Shelby, I see your real hand is up. Your mic is open.
Yeah, I just can't figure out that little hand thing on there.
Do you see the participant screen on the on the
do.
right corner,
Yes.
right side? Do you
Oh,
see a
there
little?
it is.
Yeah,
Thank
yeah.
you. And I was looking all in the wrong
Yeah,
area.
that's okay. You got it. All set. Did you have anything to report?
I just wanted to, let everyone know that in behavioral health, we have never, of course, shut those doors, and we have remained operational. We've had to make modifications in regards to services, and we have really incorporated telehealth services, and we've created telehealth hubs at different sites to help individuals that are at risk and perhaps to avoid having to be in the same office with the clinician or the doctor. They could be in one office up on the telehealth huge screens that we have. And the doctor or the nurse can also see the individual, and they'd be in another room separately, but be able to assess them, talk with them, meet with them. So we've had 6 sites set up that we've strategically put them throughout behavioral health, down in same-day access, of course, and outpatient, with jail services, with Pathway Center, with case management services. So we have been, just trying to utilize technology to support us, during COVID. So I just wanted to make sure everyone knows that we're still, operating. We're seeing people much more through telehealth services and telephonic means.
Okay, thank you, Shelby. And I see a virtual hand up by Andrea. Andrea, your mic is open.
Thanks. I just want to say that I was a part of Safety Valve from Emergency Services over the weekend, and the telehealth worked phenomenal. It was very clear. The sound was great. It was a big screen, just phenomenal. Actually better than Centera's, if you ask me, because I've seen theirs. And the patients don't react as well as this one did in this case over the weekend. So really, it's not just on paper. It actually works well. So congratulations, Shelby.
Okay, thank you. Thank you. And just a little housekeeping item. Don't forget to put your virtual hand on if you're done speaking, just so I know that I don't need to call on you. You just click the hand again to be able to do that. Okay. Shelby, did you have more to add?
No.
No. Okay. All righty.
I was just
Thank you.
Feedback.
Okay.
Thank you for that feedback.
Thank you. Oh, okay. I have a virtual hand up by Teresa. Teresa, your mic is open.
Yes, and this may also concern Carla a little bit. And the reason I think it's so fresh in my mind is we held the Senator Kiggins visit this morning, legislative visit, and she, who is a practitioner, was expressing frustration with saying she doesn't know how to get people to services. And we were saying that the CSB and mental health supports of the city are there. And I wonder if it might be helpful for somebody to reach out to her office, just say that, maybe we referred, you might, there might be some things that are missing as she's trying to refer patients and clients, and, because she does have a strong agenda in support of mental health. And,
Okay.
she's willing to work across the aisle. So the more that we could kind of get her on board as an ally, and building those relationships, I think would be really, really good. Just, I know that's a side note, but because it dealt with your report, and the telehealth sounds so helpful. She just kind of felt like the doors were closed is how she was kind of feeling, but she was open to hearing differently. Okay.
Teresa, do you have her contact information?
I can give it to you, Shelby, in the chat.
Perfect.
And once again,
And I'll reach out
she wasn't picking on, but yeah, just to say, we wanted to make sure that her office was aware of supports.
Perfect. Yes, I have no problem doing that. I'll do that. Absolutely.
Okay. Thank you, Teresa. Carla, I see your virtual hand is up. Carla, your mic is open.
Yeah, thanks, Teresa, for that. I find that surprising because I know CSB has reached out to Senator Kiggins numerous times, and have kept and has at least. Well, I'm not sure that they've talked with her, but I know they've talked with her office, with her LAs and such. But I'll circle back because we all had delegates and senators to call and meet with. That was just assigned. So I'll see where they are with Senator Kiggins, but she, like I said, I know that we have reached out to her.
Okay. Thank you, Carla.
And we'll do. And sorry, Dominic, to be interrupting. Yvonne
That's
Lewis
okay,
was
that's
on the
okay.
phone with us, who on
Uh-huh.
CSC. So it was really very relational. I'm just saying that this could really help in helping her to feed in and possibly become a champion. It wasn't so much critique as it was. She was just kind of, dealing with some questions around access.
Okay.
Okay, thank you, Carla. Thank you, Teresa. Okay. No, and once again, don't forget to put your virtual hand down when you're done speaking. You just have to press on the hand again, and that'll lower it. Okay. In that case, back to you, Tommy.
Okay. Thank you so much. There's so much going on, and I just feel like people don't know. And a lot of times they don't know about these resources. And I think, that's one of the things we need to think about, of how we can help get this word out of all the things that are available and that are happening. I want to report, since the February meeting, a lot of my focus has been on promoting STEP, and originally writing a report to send to City Council, which had to be approved by the Human Rights Commission, asking that they sponsor STEP Virginia again this year in their legislative agenda to the General Assembly. That was done, and then I spoke at the Legislative Collaborative Table, which I think so highly of because of the excellent advocacy work regarding accepting STEP again this year as one of their items, which they did. And then at the Social Justice University, that university where we educate people about the issues that Legislative Collaborative Table is sponsoring, so that we can encourage them to contact our legislators and to have information, and a fact sheet for social justice. Well, I guess it was for that. And then later for this work that's going on right now of Legislative Collaborative Table, visiting with all of the legislators. The last fact sheet, STEP fact sheet, included up-to-date information about the situation of STEP and the history and what to ask for and that sort of thing. And I will be one of the people that will be speaking to the delegates. We'll be on one call tomorrow, and then some later this month. And from my point of view, if I'm coming from Human Rights Commission, STEP Virginia is the only mental health issue that I can speak for, because it is approved by City Council. But I suppose as a regular citizen, I can also speak for the other mental health priorities that we have, which include, I've been attending all of the Virginia Association of Community Services Board, all of the VACSB public policy committee meetings, and that's when all the representatives throughout the state, it's a teleconference. And I've been on those in order to keep up with what, the situation is and how things are progressing and that sort of thing. For especially for STEP Virginia, I've been sitting in on those and learning a lot, as well as NAMI Virginia, receiving updates from them, and also just tuning in for different lectures and seminars that relate to mental health over this period of time. So I think that's about all I'm going to report right now. But again, I compliment everyone on all of the activity that's been going on during this time, when we've all been under such restrictions with that terrible, terrible virus. So anybody else have anything to report? I think that's quite a lot.
I have a virtual hand up by Carla. Carla, your mic is open.
Thank you. That's a great report, Tommy. So STEP Virginia is also a legislative initiative for City Council. Is that what you said?
They did. They're sponsoring it also.
Okay.
That means that, they have legislative items that they
Right.
advocate for with General Assembly, and they accepted Step Virginia again this year. So yes. Mhm.
Okay. Okay. Good. The other thing, I don't know how many of you have talked with, Delegate Kelly Fowler, Alex Askew, Nancy Guy, a lot of the Democrats that are delegates, because since they are in the majority, and I know a lot of bills have already been pre-filed, but since they are in the majority now, they certainly have the muscle to try to push more. And I know that this year there's going to be tremendous budget cuts. And I think I mentioned I spoke with Nancy Guy for about an hour and a half on Saturday, and we were talking. That was one of the things that we talked about. She's an old friend, so we talked about a lot of stuff. But we talked specifically, and one of the things she said, and it was a good point taken. And she said, we keep going back to mental health and STEP and different issues, supportive housing, different things. How much money? And she said, we just keep putting money to it, and we're not, we don't always see the, well, I mean, as much money as they can put to it or are putting to it. And so, she mentioned to me, she said, well, how much money do you think it would take really to solve the problem? And that I didn't know that one. But I mean, I think what she was saying to me was, absolutely, we want to help. We want to, to fund these these issues, but how much will it take so we can see a measurable difference?
Well, one of the reports that I wrote was in more detail. I did send that to you in terms of, and I have another one that's in more detail of what the history of the whole STEP thing is. And, the fact is that I don't have the detailed amount of money that's needed. I do know that what was appropriated just covered, the 9 core services. And once we get those core services, we would have the comprehensive community mental health services that we've been needing and have been promised, as we've said, since 1963, when the Community Mental Health Act was passed. And the intention was at that time that the people had been in the state hospitals all of these years, and now we're going to have the services in the community, and therefore we will not have people going to jail and having to go to the hospital, homeless, all of those things. We still have all those problems, and we still are way underfunded. And whenever, what is that? I have a mental health. I let the dog. Did I let him in? Oh, okay. We have a dog that likes to go in and out. His is right.
I love you,
that track.
This is why I love you, Tommy. No, I mean, it was a really, it was like I said, it was a great conversation. We talked because I interspersed some things with the Council of Aging, with mental health, with what's going on, and with with beds for inmates whenever they're in a crisis situation. And she asked that question. It was a good question.
It is.
She said, how much, especially whenever they are really going to be drilling down because of budget shortfalls, how much will it take? How much can we plan on moving forward? And I just thought it was a good question to bring forward.
Well, it really is. And I have seen an estimate. I don't have that in my head of what it would take. As I think I started to say that so far, only 2 of the 9 core services have been funded, and that is same-day access, outpatient services, and same-day access, primary care, which means taking your temperature and that sort of thing, getting you to a medical doctor if you need it. And the third one would be outpatient services. So until you get money for that, you really don't have more money for services. You might be seen the same day, but you might wait. And Shelby knows a lot about this. You might wait a long time to get your appointment for outpatient services, which includes a lot more things. And the next one was crisis mobile, and that's partially funded. Outpatient was partially funded. And then, the others are down the line of peer and family support, psychiatric rehab, veterans services, case management, care coordination. So last year, I think we all know that in the budget, some more money was appropriated for STEP Virginia in the governor's budget last year and approved. And then in the spring, April, that money was taken out of the budget because of the horrible, budget restraints caused by the pandemic. This summer, the special session, which I guess was ended in August, that budget, that special session developed a budget that put STEP back in, and some of the other mental health services that had been funded, but the money had been taken away last spring. As I understood it, the governor signed that budget, but he did not specifically appropriate any more money for STEP. Now, I hope this is not too long-winded, but now the next governor's budget comes out on Wednesday, and when we see that, we will see if he puts any money. What was that? Oh, well, the governor's budget comes out on Wednesday.
Are we not supposed to have one today?
What's that? What was that?
Somebody needs to put their phone on mute. They're talking and we can hear them.
Oh. So that budget comes out on Wednesday, and we'll see, if he does, and if he doesn't, as I understand it, and this is from VACSD, if he has not put money back in there, we ask that some of the legislators put in some budget amendments that would put STEP funds back in there. We'll find out how much.
HRC meeting.
Somebody. So that's really the status of STEP right now, is that the special session put the money back in. The governor signed that budget, but did not specify anything for STEP in particular. And on Wednesday, we'll find out if he does put those funds back in for STEP. And that's what we're advocating for, is funding. So we've just been going one step at a time. The question that came from her, the General Assembly a couple of years ago voted for all of those steps to be implemented by 2021. And that's next year. And, we're nowhere close. So regardless of what the total amount is, we're really not moving along very fast on it. But that's why we have to keep advocating.
Okay, well, thank you, Tommy. I have a hand up by Shelby. Shelby, your mic is open.
Actually, and I put my hand up initially, but then you started speaking to what I was gonna say. So actually, it's just so hard to gauge exactly how much is needed. When I look at funding and everything we received from the state last year. And I'm thinking of some of my programs in particular, like in fiscal year 21 for the permanent supportive housing. We had 917,000, but it's a different environment now that we're working in. The needs are shifting somewhat. I see more need for permanent supportive housing, although we received 917 for fiscal year last year. This year and going to next, it may look different because of how the COVID actually has impacted our area. Also had the homeless population and program, the PATH team that I work with, and the increase in homelessness and needs of the individuals in our community is growing exponentially. So we have to take all that into consideration. We may not ask exactly for traditional funding that you've asked for in the past. We need to do some kind of analysis to assess the impact and the additional amount. So it's even greater, is my point.
Yeah, right. The need is greater. And we have a little item on the agenda about COVID impact, but we'll get to that maybe. So if we want to look at the agenda, do we want to look back at it now?
I actually have some virtual hands up. Virtual hand up by Sylvia. Sylvia, your mic is open.
Hi, Shelby kind of touched on it, so did my questions, so did Tommy, and that was the funding that we get from the state. Shelby, does your office allocate those funds, or is it you that does that for the mental health, or how does that get allocated through the city?
I'm referencing the funding that we're getting from the department that is then allocated to the different CSBs in accordance to the needs of that CSB. And so I was referencing in regards to permanent supportive housing under my supportive residential services, and that 917,000 came from the state. That's what we were allowed, or that's what we were allocated last for fiscal year 21. But also we have to take into consideration, and as Tommy is referencing in regards to jail and reentry services, I know in fiscal year 21, I want to say it's almost the same. I think they got about 916,000 from the state. And then Virginia, I think we received 815,000. So, but not only even the DD waiver side and the DAP side, that's not in my area, and I'm not certain on that amount, but it's, cumulative of different areas specific of the need to fill with STEP Virginia. So
Thank you. And also someone mentioned homeless. I was wondering during COVID, and it's getting cold again, how the homeless were faring with mental health issues. Does anybody have any current update?
Could I speak? We have that on the agenda.
I'm sorry, I don't have
we
the
have
agenda.
housing on the agenda, and I was thinking maybe if we would follow what we have.
I have another virtual hand up, Tommy. Andrea, your mic is open.
Thanks. Yeah, I was just going to say the other thing that came up from the last emergency session was regarding the mobile crisis teams going out, and thus far it has not been mandated. However, jurisdictions throughout the Commonwealth have gone ahead and tried to start it with people who already have, emergency services job, and they're just one day a week trying to go out, and now they're looking for more mental health with law enforcement partnerships and having mental health actually go out first. And the law enforcement person sit in the car just about is how they prefer it. I don't think that's how the mental health wants to have that happen, but really, I would say to really do the STEP program, it's going to be 10 times as much money as they're putting in now to fully fund everything, instead of what we have now is partial funding. So they're trying to squeeze it in with personnel that they have now, and they're already short people, and then hiring freeze, you can't get them in, and a high turnover. It's a stride, no emergency services. It's a stressful job, and 24/7 is a problem because a lot of people don't work 24/7, even though they come in knowing, oh yes, I'll work, and then when it comes down to it, it's a problem, and turnover is really tough. And then life, they don't have enough people to help people. So with an increased demand that they're trying to meet, really money is what will help fix this program. Higher salaries to get people to stay, number one, and then you can develop these long-term relationships with people, especially the homeless. When we lost our girl from Pat that was there for 20 years, it was phenomenal. Now she had a master's degree, she was clinical. Now we don't quite have that. We have outreach, but we're just always behind the 8 ball. So if someone wants a number, the number I would throw out is 10 times as much as we have now. And then, if we got half of that, we'd still be winning. Thanks.
Okay.
Back to you, Tommy.
I think I've got a little lost here, but I was thinking of something. Oh, I know. If you wanted to find out where our money comes from, you could go on, look at the JLOC, Joint Legislative Audit and Review Committee review, because they did a review of Community Services Board's funding. I think it's about a year or so old, but I did send you today a link to a dashboard that shows you what each city, community, jurisdiction gets, how much, and where it comes from. Like some comes from Medicaid, and some comes directly from the. And what I understood from the JLOC study that the state behavioral health and developmental services department decides what the Community Services Board get that comes from the General Assembly, and according to JLOC, they just do the same thing every year, and without considering how much each city area needs. And JLOC was recommending that they take another look at that. So, gosh, there's so much information out there, but that does have to do with, funding and where our funds come from, because sometimes I think we're just after those legislators to give us money, and yet they're not responsible for the money that comes to all the money, it comes from a lot of different sources. Medicaid is a big source. So I think that was relevant. But if we go on, is there anything else before we go on to the next thing on the agenda?
Does anyone else have anything to add? Okay, I'm not seeing any more virtual hands.
Okay, so if you look at the agenda, it has down here the top issues most important to the Mental Health Taskforce, and that was what we decided a long time ago, but we need to be reminded periodically. And the first one is the availability of a comprehensive system of mental health services to include state-of-the-art treatment and support systems. Well, that's the same thing that STEP wants to do. So we're right in line with our top issues by continuing to focus on STEP. And then when we get down to action planning, we still need to talk a little bit more about that. And then elimination of stigma was another one, and increasing the advocacy base. We just don't have enough advocates for mental health funding. That's always been a problem that I see, but that's on the agenda if we get to it. And so those were the three main ones. But if we get down to action planning on the agenda, suggestions received for next step. Okay, well, the next one is to continue our advocacy for STEP Virginia funding and implementation. And what actions do we want to take? Now, we've already been talking about that some of the groups we're working with are making the calls to the legislators, and we're involved in that. But what more can we do as a committee? We're a task force now, by the way. But what more can we do to further this effort to get this funding? Because again, there are not too many advocates for mental health. There really are. I don't know if anybody disagrees, but I don't think there are. As I've said, you can increase awareness all you want, but if the people don't make those calls, then we're not going to get funding. So what do we need to do? And now one thing I thought of, and Carla and Teresa were involved in this. Teresa was involved in this, if she's not asleep. Teresa, oh, they can't hear me. Are they all, can y'all hear me?
We can all hear you.
Okay, right here.
We were talking about what can we do? We're down here to action planning on the agenda. What can we do to help ensure that STEP will be funded? Because making it available a comprehensive system of care is one of our main objectives, and STEP is what would do it. One thing I thought of was last year after the Mental Health Forum, those of us that were working on it, we had people sign, and I think Jen had a list also, but after the forum, we had people to sign if they would be willing to make one call to their legislators, asking them to support STEP. And I know Teresa and I were involved in those calls, and possibly Carla. And we thought we got pretty good response when we looked up their area, who their delegate and senators were, because we said we would do that. And then we called them, and they were receptive and asked if they would make those calls. We had 38 people on our list. I'm wondering if that's something we want to do again. Call these people. These were not necessarily people that were already involved in mental health, but they were at the Mental Health Forum. So that was one thought. Now, do we have other thoughts about how to continue this advocacy and what are other things we might need to be doing?
I have a hand up by Jen. Jen, your mic is open.
Thank you. I think it's great what you're doing and pushing. That's so important. We, NAMI, hosted How to Tell Your Story in a succinct, compassionate found is that people are very willing to help, and they're willing to say they want to get involved, but they're not. We asked them to and a few said yes, a core group, and the rest of them, was crickets. So we decided that we were just going to go forth and do what we could. And so, just like Teresa, Kay and I have been talking discuss that. I think one personal stories are very important, and then just ask and then
You're breaking up a little bit on us, Jen, so we can't make out everything you had. That's okay.
Shoot. Okay. So we had. Tell me if you can hear me. If you can't, I'll just stop talking. But we had a lady who lost her son tragically this year. He was in and out of jail, in and out of psych hospitals. There was no supportive housing. He ended up overdosing and died. Been incredibly strong to be able to attend some. We really feel that has made it. Some people understand needed chickens today. She it's really it's a wonderful thing. But this is a small time with that time there is support. And the people have been completely supportive for their family crying because and then their house and the street they cannot handle it. And there's we supportive, not supportive, but just how it's available in Virginia. Currently, we have 70, which is pretty sad. According to the needs out there. This is just, I don't even know if it's feasible, but I'm wondering if as an committee, city council, and public or
You're breaking up again. Do you have any other kind of devices on your Wi-Fi running on your Wi-Fi? They may be kind of taken away from the bandwidth for the WebEx.
No, I haven't had this happen before. I'm sorry. So maybe I need to just.
Or you could also what you can do is call on your phone, and then just use your phone as your audio, and then have keep yourself on mute on the computer. That's an option if you want to try that out.
What's that number, please? What number would I?
It was in the email that I sent. Hold on, let me find it again. All right. So
I have it. Can you hear me?
We can hear you.
It's 415-655-0003.
3. Yep. But then there's an access code that you have to put in, and I can send it to you in the chat. Okay. You're welcome. All right, let me just send this to her very quickly so then she can call. Okay.
Well, we had housing on the also for the next item.
Okay, all right. So I'm gonna so Jen, if you want to try ahead and use that access code to get on, and then once I'll see that you're on, and then we'll try to see if we can get you using your audio through the phone. Okay, thank you. Okay, I have a virtual hand up by Teresa. Teresa, your mic is open.
Thanks, Dominique. And Jen, I'm just kind of following up on both what you and Tommy were saying. We're never going to have enough money resources, and we're never going to have enough advocates. Can you all hear me? Dominique,
Yeah,
we can hear you. No,
Okay.
you're unmuted. We can hear you.
But we are growing. I mean, there hasn't been a single legislator that we've come in contact with this time that is not supportive. Every single legislator is saying they're supportive and they're starting to get it. As you said, Tommy, we've passed. We've kind of backed up a bit because of the impact of the pandemic. I think we need to keep using that as our biggest argument for why we need to keep going forward. As Andrea said, the pandemic has exacerbated mental health issues in the community in a big way. So 30, like you said, the original budget did not carry it. Then they, because of special session, the governor, ended up putting it back in. So that 30 million was restored. That only gets us back to the place that we were. And like you said, Tommy, depending on what the governor does with the budget, it may not be in there. So it becomes all the more important for us to be small but mighty. As Jen said, when we were on with Senator Kiggins today, it was clear that NAMI had just had a meeting, and it was clear that the CSB was following up with the meeting. So our advocates are growing with the same message. So I'm really proud of that. I'm proud of the Human Rights Commission for staying linked with the Legislative Collaborative Table, because everybody doing it together gets us out of our silos and keeps pushing that forward. We have to have those 9 components funded, but that's not going to happen overnight. We got to keep pushing it. In the meantime, Jen is lifting what are huge emergency needs right now, also exacerbated by the pandemic, because if people don't have supportive housing, especially in the mental health arena, they're not safe and they're not keeping other people safe. And so, I feel like we should probably move into that arena in some way. Our last forum was all about destigmatizing mental health and making sure that people knew that, health includes mental health. And maybe Jen's desire to educate, around the, affordable housing is also an issue across the board, Jen. So like we're saying, there's not nearly enough of it, and people are struggling with housing, and even people without mental health conditions are tsunamis coming in front of us in the next probably year, as far as some evictions, and we know that, housing costs are going up, because a lack of inventory is making, and a low interest rate is making that worse. So, and we have to find the balance with making sure we can build those relationships with landlords so that they're not afraid to serve people, because mental health conditions are a part of all of us. So I agree with you, Jen. We need our own presentation, and poor Carla, she's like, okay, yes, we need money, and now we're saying, yeah, we need money, but we can also do it, step by step. It's no pun intended, but Step Virginia is step by step, 9 components. But the more thoroughly we fund those, the quicker we fund those, the better off we're going to be as a community. Our CIT teams and all of that are working beautifully. So I just think, Jen, you need to take us into the arena of just how bad the housing situation is. And then we need to figure out a way to wrap our heads around it. And I'm sorry I was so wordy, but I was just full of passion after the last.
Could I say something? Could I say something?
You can go ahead, Tommy.
All right.
Thank you, Teresa.
Okay, thank you, both of you. The housing issue was the next thing on the agenda. But before we go on to that, we've already talked about what people are doing to support and promote and ensure funding for Step Virginia. What everybody's doing, but is there something more this body, Human Rights Commission, can do within the next few months that would help increase that? And I've heard what people are doing, and we are already doing, but I'm working along with the Legislative Collaborative Table and speaking to legislators and with NAMI and with the recommendations. But what can we as a Human Rights Commission do that that's not already been done? I mentioned whether we might call the 38 people that were willing to call their delegates. And and what we were saying last year is we were not asking them to tell a story, but just to ask that they support the NAMI fund, the STEP funding. Do we want to try to do anything else, just in the overall STEP before we go on further into housing?
Tommy, Jen has been connected on the phone, so I want to give her a chance to finish up what she was saying. So, Jen, can you hear us?
I can. Can you hear me?
Yes, we can.
Good. Oh, perfect. Thank you. Okay. So, Tommy, I'm not, as far as STEP goes, if I can just defer that, I wanted to just finish making one point, if I may. As far as the personal stories go, I think that if we're going to continue to advocate, I really am a firm believer in having people who have experienced negatively how things are going now to show that these are human faces behind the figures. I really feel like that does make a difference. One person who's near and dear to me is a person who's a connection facilitator for NAMI, really nice man, and he lives with agoraphobia, has a very, very hard time getting out of the house. And he's been on a wait list. Now, he may be exaggerating by a year or two, but I bet not a lot. He said he's been on a waiting list for Virginia Beach supportive housing for 10 years. And he gets an email every year saying, thank you so much. We just still do have you on the waiting list, and we'll let you know when something happens. And I'm not, I'm certainly not dissing anybody, because he's also been on the Chesapeake list for 5 years. He's been on the list for Norfolk for 7 to 8 years. And if that isn't something that moves people to say, look, we've got a problem, I don't know what is. So the last thing that I said that I don't know if anybody heard, and I don't know whether it's feasible, but I'm wondering if, as a Human Rights Commission, if we could go before City Council in a private meeting with them and explain to them, with a few people who, like this person I was telling you about, explain to them the necessity of helping, maybe with a public-private partnership, to donate land and, find some funds to create supportive housing for people with mental health issues. Thank you very much.
Thank you, Jen.
For what Jen has said, I definitely know that the family messages make a huge difference. For many, many years, I went to Richmond, and we had family members, and they would tell their stories. And I think that makes a big difference. I really do. I think families make a larger impact on legislators and many people than most anybody I know, really. And that's who I worked with for 40 years. With families of people with mental illness. And I do think that they are very essential and do the best job. But I was just trying to say, what can this body, this Human Rights Commission group, mental health group, do we want to try to do anything more than what's already been done? That's all I wanted to settle on that point.
I have a virtual hand up by Shelby. Shelby, your mic is open.
Thank you. I was listening to you all talk in regards to the housing needs in the city of Virginia Beach, especially with the individuals suffering with mental health and substance abuse needs. And I want to clarify a little bit just in regards so that we as this group have a little bit better understanding of the housing stock that we currently have. 72 is just for the permanent supportive housing slots that we have in regards to our capacity, but we have a total of 172 slots or capacity in different programs between our adult living facilities, our adult foster care, our Beach Park East and Beach Park West facilities, CAMG. And with the 172 slots or capacity that we have, 162 of those slots are currently filled. We still have a waiting list of 142 people. Okay, you hear that? So 172 capability, 162 admitted, with 142 on the wait list. In part, the few people that are the individual admitted versus the capacity, some of the delay of those few cases are situations where maybe we can help or take this in consideration. They need things like birth certificates, proof of ID, pictures IDs, physicals, TB tests, negative COVID tests now. These things are hard for these people to come by, especially in this current environment. We have workers that are out there outreaching individuals homeless in the community, under a bridge perhaps, and you're trying to set up a physical, for them. It can be quite challenging. But those are some of the barriers that we're running across in regards to those that we have in play. We're trying to get them the housing, but some document readiness is needed. Another thing I think we need to take into consideration is this physical housing stock in this city. We've worked with Department of Housing Neighborhood Preservation. We're continuing to work with them in regards to how to grow housing stock in Virginia Beach, because you have a lot of people in the community say, not at my back door, not in my neighborhood, not in my, no. And so, we try to work with builders and with landowners and homeowners in regards to, strategically having these supportive housing programs throughout the city. But that is another barrier that we do run into, and we have to always keep that in mind when we're talking with city leadership, because that's a genuine concern in regards to how can we build this housing stock if no one wants that in their neighborhood. So I just want to put those pieces out there as well.
Okay, thank you, Shelby. I have a virtual hand up by Sylvia. Sylvia, your mic is open.
Okay, caught me with my drink in my hand. Thank you. I just, someone, and I think it was Jen, said something about approaching city council. Councilman Bellucci is a huge advocate for mental health, and I don't think we need to do anything because I know that the one attribute that he does have is he follows through. But my question was that, they're getting the word out about STEP and all these other programs, and I think we have a lot of advocates for it. Am I hearing you that part of the problem is getting the word to the public that hotlines and availabilities and what they can do? Do you see that as something that this committee could do, or do you think there's enough out there?
Anyone have any discussion or comment on that? Shelby, I see your virtual hand is up.
Oh, I had to put it back.
Oh, okay.
I apologize, I hadn't put it back down.
That's okay. That's okay.
There we go.
I have a virtual hand up by Andrea. Andrea, your mic is open.
Yes, I think that is a good idea, because the more you put it out, the more people will hear it for the 10th time. They'll be paying attention this time. A lot of the problem is also, until it happens to someone in your family, you haven't paid attention to all this stuff that's been going out. And now all of a sudden, what are we supposed to do? And as someone who's lived in this community for almost 30 plus years, and my job, I meet people, I get calls from friends of friends who, hey, now, someone's having a psychotic break. I think my mom needs to be ECO'd. What's out there? And then I'm always pushing for discharge planning. Can someone come home? But it is just that they don't pay attention. So I think putting signs up, PSAs, flyers, whatever, sides of the bus, sign on the bus. We don't have very many billboards here, but I will say that the police department is doing things with the QR code. When you go out now, you have to put your camera over the little code to get the menu. If you go out to eat, well, now we're going to put that on every police car. So we feel like that's a recruiting billboard on every car, and people can use their phone to get it. I would say it's money well spent to put it anywhere we can. It's flyers in the grocery stores, places where people congregate. Most 7-Elevens have some kind of board. The Wawas all have a board right next to the restroom. So anything that we can do and print up will be seen. And people say, well, I didn't know this was going on. Well, we've been doing this. Most people don't even know about emergency services. They think it's 911. So yeah, the more we put out there, the more there is. Or even if we get with a group that's, you know, with the mask police, we have all these mask PSAs on commercials. So you could even, call your local office. We have 311 in Virginia Beach. I bet most people don't even know we have 311 that will direct you to find out what services are available besides vbgov.com, which I don't find very user friendly as a citizen or employee to find out, hey, what are these services or where's the supportive housing? Just like Shelby was talking about, 172 units. They're invisible to people, except if you're on the waiting list. But yeah, I think that's a great idea, and if anything would help. I'm done.
Yeah, great.
All right, thank you. Thank you. I have a virtual hand up by Sylvia. Sylvia, your mic is open.
Thank you. Following up on that, I mentioned that Tommy, and now I speak as a veteran actor for our video that we put out, the Human Rights Commission, for our awards program replacement. But that was relatively easy to do, but maybe some of these families that you talk about or the members of this committee could do a little PSA that we could put on Facebook and then share it. I think we got a lot of views, so I thought it might be a valid suggestion.
Okay. All right. Thank you, Sylvia. Tommy, it's back to you.
Yeah, I see. You know, we do have that on the agenda, create a video regarding mental health issues. And so, I think that's a great idea, and that's something we might work on. I was trying to pin down exactly what our next steps are with these different areas. I don't know if y'all printed out your agenda, but the first one was, about STEP and what do we want to do. And then the next one was housing. And then we skipped faith communities, but we also had the create a video regarding mental health issues because Sylvia had mentioned that before. So where do we want to be right now in terms of future action plans and exactly what we want to do? Because we don't want to leave any of these items vague. We want to have a plan, and we do still have time. And I don't want to be rude, but if we could kind of go along and make a decision on each point. Do you have your agendas? Well, the first under action planning was, what do we want to do? Or do we want to do anything more about STEP, just us, for our plan? Or do we just I know that everything that's been mentioned is good and we need to keep up with that, but does this group want to have any special thing that we want to do? Because advocacy is very important in the next few months. Do we want to just leave it like it is, or do we want to do what I mentioned about calling anybody to ask them to make calls, or leave it?
I have a virtual hand up by Teresa. Teresa, your mic is open.
Okay.
Thanks. Keeping on track. I agree that we have that list that was generated. It is going to be a little challenging because people are in challenging circumstances, but we can certainly create a script that's a couple of pages long. I'm telling you, I'm a little bit up to my eyeballs in the 30 visits that are trying to get done before the General Assembly opens, right, and doing it through the house. But I would be willing to take a script and make, 5 or 8 calls. If a couple of us would do that, you're right. We could generate advocacy activity moving into the General Assembly if they're particular legislators, which, if I'm not mistaken, that list identifies their legislators. Isn't that right, Tommy? So you could
already identified. I'm sorry. Tickle. Sorry.
So
yeah, we do.
It could. Right, you would have to delete it. Right, and if you would be, I could make a proposal that maybe you create a list with a short script, like 3 sentences, And
Yeah.
I think that sentence suggestion would be that it connect back with our forum, that they were kind enough to come to the forum, learn all that
That's right.
there was to know about STEP,
Exactly.
how much more important STEP is now because of the pandemic. And I'm sure I'm not the only one that would be willing to take, 7, 8 people. I can't take them all. Last time I ended up taking almost half the list. I know Carla took some, and we did generate more calls, and I think we do need them. But the work has to be done on the front end, which would be from you.
Yeah, I'll be glad
and I
to
think
see that. I still have the list from last year, and I have the script, and that's simple. But I thought that might be one thing we could do if we wanted to say we're going to do something more. What do others think about that idea?
I want to say I feel like that's a pretty big thing too. So
yeah. Is anybody else willing to make those calls? If I send you the script and the names and their delegate and senator?
Tommy, I need to be forthright with you also in that right now we're in the middle of multiple audits.
Oh, yeah. So you can't.
Painful desk audits. And I know I don't want to.
I understand. Yeah, I think everybody is kind of, I don't even know. I'm at home, but it seems like I'm in a meeting every hour. But is anybody else would be willing to make any calls on just, I think it's a very simple script. Jen, thank you. You would.
No, Jen, your mic is open.
No, I just wanted to say I'll be glad to help.
All right, great. Anybody else? Great. We got Andrea. Yay. Well, all right, that's 4 of us. And anybody else? What?
Sure that Jen knows that all of our legislative visits, Jen, we make a real point of making sure that someone who has been directly affected by the mental health issue is able to bring the STEP issue up in each of those visits.
That's very helpful. Very helpful. All right, well, thank you. We've settled that number 1 action planning for this meeting. So the next one was housing resources. And now, what do we want it to do? Any particular action do we want to think about? Like Jen suggested, city council or what?
Anyone have any thoughts on that? I see a virtual hand up by Teresa. Teresa, your mic is open.
Sorry to be over speaking, but yeah, I'm feeling like I'm on the Affordable Housing Commission for the city and have been working on affordable housing issues for 30 years. And yet I don't have all the information I need, Jen. So when I say that I need the education first, what you and Shelby were just doing, I think is critical for our task force. I heard, the 172 slots, 162 filled, all the, the 100 whatever waiting list, and then the document ready being, a barrier as well as NIMBY issues. But I think I just believe what we know is there's a huge need, but I need more. I just need more solid ground. I'm speaking for myself before I then, and I think the next step would be to go to Michael Berlucci as our mental health champion on city council and try to have the same kind of meeting that we had with him before on STEP, where he could hear those stories of how people were being affected and he became a champion. And I think maybe that's the way to go through it, to move it forward. Jen, just a suggestion of what I think would be helpful for me.
Thank you, Teresa.
Agree with Teresa about that. And I will say that Jen has collected a lot of information on what's available. And I sent, I think, at least 3 documents from Jen to you on what what NAMI already has, the research they've already had on the housing. But there's so many different sources. We need to get that together. And maybe Shelby knows that, or possibly Natasha Sams, who helped us with the forum. She's the supervisor of housing, supportive housing with mental health.
Yes, supportive.
So we need to collect our information. You're right. Mm-hmm. What? Sorry.
I was agreeing with both of you all, with Teresa and what you're saying, Tommy. And okay. I'm sure Natasha would be willing to join us.
That's right.
Work together. And for a matter of fact, she and I were meeting next week to talk about how we can expand PSH and funding that we know is available out there at the state, and how we can get a piece of that to
Oh, yeah. What is that, PHS?
permanent supportive housing.
Oh, yeah, permanent supportive housing. Oh, yeah, and that's part of that's in the budget too, or was in the budget for more funding for permanent supportive housing, and that special session last summer put that back in too. So we'll see, but a little bit of money here and there will help. But so I think that sounds like a good plan. So what's our next step on that? Get more information from Shelby. And then we'll talk with Michael Berlucci with our information, our documentation. Okay. Does that sound solid enough? Say yay or nay.
Anyone have, Teresa, your mic is open?
Yeah, I think that sounds great. And especially having Shelby and NAMI, through Jen hooked together so that we can get a full and Natasha, whoever this, I can't remember. But if you could send not too much heavy reading, but a little bit of reading that we could do before the next meeting. And then we would then be kind of ready to hear maybe a short presentation, almost like a little panel where you all could just kind of give a little bit of the insight for the whole picture. And then we could have question and answer so we can get a clear picture on what we need to know first. And then once we, and maybe where you all think it needs to go, so that we really are galvanized before we take our act to Michael, unless we want to try to invite him for that, participate in that little mini forum, I guess I would call it, with all of us. If you feel confident that would be good to do with him, I think that'd be great too. Either way, include him and then follow up with the meeting with him, or do that panel with him. That would be my suggestion.
Okay.
Thank you, Teresa. A virtual hand up by Jen. Jen, your mic is open.
Thanks. Teresa, I think that's a great idea. Absolutely. And I will be glad to talk with some people and send out some emails to our NAMI members to ask who's had difficulty with obtaining housing in Virginia Beach, that we'd be willing to talk about it. So do we want to just hit Michael, or do we want to try to hit the whole council at one time? What's the best way to do that, since you've been doing this for so long, Teresa?
I suggest would be Michael, and because he's already on board with you, and our hiccups and our figuring things out, and finding how to craft those best stories. And I think, yes, to include a few voices of people that can share that experience, and then we could ask for his help in helping us figure out how to take it to the council. That's what I think, based on my experience.
Great.
Okay, I agree with with that. Does everyone else agree that this is a good plan for us to move forward with?
Okay, any objection to that plan?
Okay, great.
Okay.
We're doing good. All right, the next thing on the agenda, and we don't have to discuss this, but I think we have it on there a lot, is outreach to faith communities, because we're always hopeful that Christians and people of faith will see the light and know that they need to help with this whole matter of the need for mental health care, whether they know anybody or have any loved ones. And we had a meeting scheduled last about March that we were going to work with NAMI's Minority Outreach Committee. We already had a meeting scheduled, and we were and Ron Taylor was involved, and we were going to meet and plan on meeting with the pastors group, I believe, to get started on that. But that had to be canceled, so we haven't done anything on that since. And do you think we need to just go ahead and table that until we get out of this pandemic thing? Or what do you think about that in faith communities? I know Andrea's made a lot of presentations to them, educational presentations. That's sort of like, the whole thing of educating the community, I think, too. Do you still do that, Andrea?
I have a virtual hand up by Andrea. So Andrea, your mic is open.
Thank you. Yes. And I don't know how well it would be received trying to do a virtual seminar.
That's true.
Faith-based communities.
That's
I
right.
really feel that it's kind of like a press in the flesh seeing you in person.
Yeah.
I've done it numerous times, and they've all been so well received, and we filled rooms. And even if we tried to do in conjunction with NAMI, because I think we work really well together, is trying to get our like a forum up. If we can do that, but at this point, maybe we could plan one for June and try and have like pastors and whoever wants to come, and also have a virtual option. But at least if we are able to have some type of groups together and do it that way, it worked out really well, and so many people on board. And that was a good 10 years ago, and people still remember and still tell me, oh, I remember when you came and spoke, or we did it with emergency services.
Yeah.
Also, kind of our CIT faith-based group, which we
Yeah.
really been wanting to get back
Oh,
to.
yeah. We had that for several years. Yeah. Yeah.
Yeah. So I think,
So
I think
are you
it's
saying,
a good time.
Are you saying to do it, try to do a virtual one or wait longer? I don't really like virtual things myself, but.
No, I don't either. But I'm saying wait until
Okay. I think that's better.
safe to have a group, and we could also try and do something online, do both. But I think it's more important to have it there together, when we're reaching out to people. And
I think so.
say something for your hands, something for your heart, something for your mouth, so they can eat and listen and have a pamphlet or something.
Right. I think that's good. We can continue to consider it and think about it, but put it on hold until we can actually be in person. But the next thing is create a videotape regarding mental health issues. That's the next thing on our agenda. And that's what Sylvia was talking about. I mean, that is something we could do. Valerie's not here today, but she just helped us, and she's on this task force. And she helped us with the Human Rights Commission video that we just did, and it's showing on Facebook and on the city channel. And I feel like they would be willing to help us again. What kind of comments?
Anyone? Virtual hand if you have any. Andrea, your mic is open yet.
Thanks. That would be something good to even show at the forum, that we work on getting that together now while we have this downtime, and then it could be good to go for next spring, summer, whenever we can have, we were pretty cool. We were back at 250 people gatherings, and ours wouldn't even be that big, especially with social distancing, because there's a lot of different places we could use, and if need be, get the convention center instead of a church, because people can be spread out more.
Right,
and
right.
Just one of the rooms, it would be easy to do over there. And that would be something where the HRC would be really helpful over just like what Jen and I were doing by ourselves. Is okay, now we can use the space.
I missed the last sentence you said.
I said if that's what's good with working with the HRC and the task force, because you have more clout in getting a room at the convention center, which would be
the convention center. Oh,
yeah. If we still had to do social distancing,
I got you.
We could have 50 people and they'd be spread out. The entire convention center, although it would be great if we could fill it, but small scale usually works best.
So what do others think about the videotape?
Thank you, Andrea. I have a virtual hand up by Ginger. Ginger, your mic is open.
Hey, thank you. Just a couple of points of reference. These are all great ideas. One is that Valerie informed us when we were engaging in the videotape that her workload was going to become exponentially impossible to get to.
Oh, you're breaking up on us, Ginger. You're spinning on us. Are you back, Ginger?
I'm here because my screen never stopped.
Okay. We the last thing we heard you say was that Valerie's workload.
Yeah, exponentially impossible to get to her for quite a while, but that doesn't mean we don't plan it and have it ready to go. And the
Right.
second thing is, again, good to plan a faith-based gathering and keep it in our back pocket because today we're at 10 people in a gathering. We don't know what next week, the next week will be, but good to lay these plans out, and when things open up, then go ahead. So I think this is a good time for a lot of planning of a couple of projects to move forward when we are able to do that safely. Thank you.
Thank you, Ginger. I have a virtual hand up by Teresa. Teresa, your mic is open.
Yeah, thanks, Ginger. I agree. We also have, Tommy, quite a few things on our agenda right now with the full force advocacy, especially if you get that script, you'll be working on building us a script so that we'll be, prepared to make those phone calls. And if we list this in our minutes, I want to just make sure that partners, like for instance, the IAB has a brainstorming group going on right now that is in concert with NAMI's, what was their minority committee with, if I'm not mistaken, Jen kind of went on hiatus, but they're kind of excited to still be doing this with some local pastors. Dr. Williams, some others, he's going to work with the Interdenominational Ministers Conference. So when we're ready, and the reason that's so important is that the stigma for mental health is even greater disproportionately for people of color. And so the exacerbation that's happened with COVID, not, responding, has made an uptick of something like 166% in the domestic violence arena. And so all of these things connect. They're all about human rights and human rights abuses. And so that team, of which Joni Wood, who is a NAMI member, and help me, Carla, is Joni, she was nominated, and I don't know if she's on the CSB now, but if that intersection did happen, that will be very helpful. But I think we need to keep in mind that brainstorming team as a partner for this as we move into the future. But I agree that I don't think we can do it right now. Carla, can you tell me whether Joni is on the current CSB board?
Oh, sorry, Dominique. No, she's not.
Okay.
Okay.
Thank you, Carla. Oh, yeah. Sorry. You can go, Carla. Go ahead.
Sorry. No, I was just thinking that there were some that were just put, redone to be on it, but I don't think she's on it right now.
But if that happens, that's great, because we'll have the intersection of a lot of different arenas of people when we're ready to move forward. Yeah, I'll Tracy, check up on that.
And also, if you can send me her name and information, because we are looking for some new people, and if she hasn't been on it, certainly I would love to get her on it.
That's why I wondered. Angie asked me in particular, and I thought Joni was willing. So maybe there were reasons that she couldn't. But yeah, let's check.
Okay, thank you.
Okay, thank you, Carla, and thank you, Teresa. Okay. Anyone else? Any other thoughts on the video or any other issues? Okay, Tommy, back to you.
Yeah, then we have two things. We have three things that we said we're going to do, and one was under the housing resources. And who was taking the lead on that? That's what I want to know. Did we say we have to gather the information and talk to Michael Berlucci and consider going to the city council? So was Shelby and Natasha were going to provide that information for us? Is that correct? Wait, we have a lot of information that NAMI has sent, and I sent it to you.
Yes, Tommy, I will get with Natasha so we can have some information, some talking points, and
Okay.
a brief overview in regards to the current status and services that we have in our supportive housing program.
Great.
What date do we need to have this by?
Yeah.
What date will we meet again? I'm assuming sometime in January.
Yeah, that sounds good.
Okay.
Maybe mid to late. What is today, the 14th?
All right. So
Yeah. We'll
will.
get a date before we end.
Okay.
Okay, that's great, Shelby. Thank you. And the matter of the outreach to faith communities, we talked about planning a program and also creating a videotape regarding mental health issues, which could be, but we don't have help right now from media and communications or Valerie on that. We said that we would work on putting together a program that we would present to faith communities. And
I have a virtual hand up by Ginger.
that's one.
Ginger, your mic is open.
Thank you. Regarding the video, Dominique can send to Tommy the blank template that Valerie sent us before doing our video. And so you'll have a starting point, Tommy.
Yeah, it's called the creative brief, and you just list what your objective is, what your goal for your project is, and then you can build on that.
All right, so I'm in charge. I'm taking the lead on that, creating the video then. I mean, we'd say, right? We just have to say who's going to initiate each of these projects, I suppose, right? Is that what we're doing? And the outreach to faith communities. Now, I know Andrea's already done a lot of presentations. And what was suggested by Sylvia was whatever we do in these presentations, we inform people of what the services are in the community that they don't know about, that they need to know. And that we also encourage them to be advocates in the process. So do we have anybody that would take the lead on the community outreach to faith community, working up a program on that, which we weren't going to do right away, but going to get started on creating? Would that be very different from the other videotape we're talking about?
I have a hand up by Andrea. Andrea, your mic is open.
Yeah, I already have a faith-based presentation that I've done, and I can easily add in what the services are and do our human services, behavioral, or our
and NAMI
for Virginia Beach. Yep.
Yeah, maybe NAMI.
Oh yeah, because we actually have one that we've done together. And
part of it, yeah.
I merge it with what I have for the audience, but what available city services plus NAMI to kind of just mix match our slides. But that would be the only thing I haven't specifically put in is a slide for city services.
That'd be great. So I put Andrea there.
Okay.
Well,
thank you, Andrea. I have a virtual hand up by Teresa. Tommy, Teresa, your mic is open.
Yeah, Andrea, it was our beginning project. Remember when you did an excellent job, and it was in concert with NAMI and the IAB, and we had it packaged.
Canceled.
Right? No, it didn't get canceled. We had we had it at the Emergency Services Building on Virginia Beach Boulevard, and well attended, but we were trying. It was sort of trying. We were trying to figure out how to roll it out so it can be done everywhere. And so I would say, Andrea, if we could revisit that template and, with the NAMI connection, and the one thing we thought was really important was to have a person that's experiencing the issue, which Jen would be perfect because Jen was a part of this too. It was Jen and then I just say we pick up that banner where it got left off, and just have it be ready to roll out when the time is right. Is that making sense to everybody? Because there's no sense reinventing the wheel.
Yeah. Andrea said she has that.
And Jen, is it sounding familiar? Is that sounding familiar to the two of you?
Oh yeah.
Okay. So and so Jen, I guess, or Andrea, both. the voice of the directly affected person would be kind of the piece that we would need to make sure is a part of that. And then, like I said, target audience, we can just start moving on once faith communities are able to re-engage.
Yeah, definitely. Because I have it. I mean, it wouldn't take me long to,
Adapt.
rearrange it a little bit, and I can definitely do that and get up with, add the slide for all the city services that are available.
Update services, and we're good to go because it was excellent.
Yes. Mm-hmm.
Okay, thank you, Teresa. Thank you, Andrea. I have a virtual hand up by Ginger. Ginger, your mic is open.
Thanks. In the respective time, Dominique needs to wrap up her workspace and leave out by 5. So it sounds to me, Tommy, if you'll excuse me, that we're pretty good to wrap up here if you want to just draw it.
Okay, that was one thing that I've already forgotten. Taken good notes, but create a videotape regarding mental health issues. Who was going to be the lead on that?
That was you. You are going to receive the template.
Yeah.
Oh, great. Okay, I've got it.
And I'll send the creative brief to you for that, Tommy.
Great. Okay, I've got it.
Okay, we have someone joining
Okay,
us on the call. I think this might be Shelby. Let me just check and see. Shelby, is this you?
Yes, it's Shelby.
Okay, that's what I thought. I saw you disappeared on the video, so I figured that was you who called in. Okay, great. All right.
I put you in the chat.
Okay, thank you. It's okay. Okay, with that,
Tommy,
Tommy, Teresa, your mic's open.
Yes, so sorry. I was also, Tommy, you take beautiful notes and your minutes are excellent. So when we get your minutes, that will let us know what our tasks are.
I'm so sorry.
So
I was so involved in this excellent meeting, I forgot to take many notes. And I don't know if our dear Dominique recorded it or not.
Yes, I did.
See? Just send me the recording. I'll do the minutes. Can you do that?
Yes.
Great. Well, then, thank you so much to everybody. And it's been great seeing you again. And I think we covered a lot, and I think we accomplished a lot. I don't know if we made up for lost time, but we're certainly moving forward, and I think that's good. Oh, do we want to set a date? Do you want to, or we want to say approximately? And January, what's today? Monday, not a good day. Do we tentatively want to set a date for mid-January? Or we can do a doodle pool?
I can do a doodle.
Oh,
Mm-hmm.
okay. Does that sound good?
Yeah.
Okay.
Yeah, I'll do a doodle poll for the 3rd week in January, the week of the 18th.
Okay.
Is that? Oh, what's later, Ginger? Ginger, your mic is open.
Yeah, that would be a little soon because we've got holidays and we won't be able to get materials and ideas and things.
Yeah,
so
that's true.
Each of us are going to be pushed. I would say the end of January is
Okay.
good.
So I'll do the week of the 28th. I'll do a doodle poll for the week of the 28th.
Thank you.
Yeah, you were right. You're right. The next 2 weeks are basically taken up for holiday, and yep.
True, but the 28th is a Thursday.
Oh, I'm sorry. I'm still on December. Let me scroll down. So the week of the 25th.
Anyway,
the week of the 25th.
Yeah.
Yes.
Again,
Okay.
thanks to everybody, and thank you, Dominique, for
You're welcome.
keeping us straight. And y'all have a very happy holiday, Christmas. Look forward to seeing you in January. Always feel free to call me, send me emails about any questions.
All right. I like to unmute everyone at the end of the meeting so we can all say goodbye.
Bye. Good.
Happy holidays.
Merry Christmas. Bye. Bye.
Bye. Be safe.